So how can you tell if your patient who is in the prediabetes range has insulin resistance and hyperinsulinemia, or maybe they're not producing as much insulin, but they don't have insulin resistance and hyperinsulinemia? And how do you tease out all these root causes? Is it their medication, one of their medications? Is it their, what is it causing their prediabetes? It's not an easy answer. But I think it's time for us to learn how to stratify our assessment of prediabetes, because there is no one prediabetes. Everybody's a little bit different. And the assessment that we do as nutrition professionals needs to be more sophisticated. It needs to, yes, include the continuous glucose monitor data. And of course, it's part of my CGM interpretation webinar for professionals. But the other part of that is a really good history. What are you looking for in the history? What medications are they taking? Because remember, medications can cause high blood sugar. So learning how to check those out, evaluating labs and learning what labs to request and how to look at them to help stratify this prediabetes risk assessment, or not producing enough insulin resistance, too much insulin, a little bit of both, not enough muscle, what's going on, or was it just their medication? So I think there's a lot to this, and I don't think I can give a definitive answer in one webinar, but I'm going to take a stab at it. So this Friday, noon Pacific time, we'll be doing a webinar for practitioners. And if you're not a practitioner, just be prepared. This is going to be pitched at a practitioner level. And we'll be talking about what are the signs that tell you this person has insulin resistance and hyperinsulinemia versus lower insulin production, and how do you know when it's their medication or inflammation versus stress, or how do you know all those things? So let's try to cover that in the webinar. And remember, I always try to leave time if someone wants to ask some questions about some CGM data they have from their patients, and share that anonymously. So come join us. You'll get the replay of the webinar when you register, and you'll also get the slide deck. And I hope it's helpful. I really want to start this conversation more about being able to glucotype a person and give them a more personalized assessment, and therefore a more personalized and more effective treatment plan.